Hi there, Ms. Marone.
Hi.
Hi, my name's Angelica. I'm a DNP student with UMass Amherst, and I'm just going to be doing your health history today. All right, I'm just going to have a seat here. Can you tell me your full name and date of birth?
Christina Marie Marone, 11/10/1990.
Okay. Can you tell me what gender you identify as?
Female.
Okay. And do you have any, what's your current marital status?
Single.
Single. And what is your current occupation?
I'm a nurse.
Marvelous. So this will go well. And why are you here today?
Just a routine.
Routine physical.
Yes.
Correct. Any past medical history that you have?
My personal history or family?
Yours.
Mine. I have frequent UTIs. I have GERD, and I've had my tonsils removed.
Okay, so UTIs. When was your last UTI?
It was last year.
Okay. And what normally do you use to treat those?
Bactrim?
Okay, so you go and see a provider every time and get a prescription?
Yes.
How about yeast infections?
They usually come after the UTI.
After the antibiotics?
Yeah.
Got it. And then GERD. So you have heartburn. How long have you had that for?
For 3 years.
Does it come and go? Is it mostly every day?
It comes and goes.
Have you tried like not laying down after you eat, avoiding spicy foods, like things like that?
I've been avoiding spicy food.
Yeah, do you
and
know?
It's helped.
Good. Do you know what kind of like exacerbates your heartburn?
Definitely spicy food.
Yeah. And then do you take any medication?
Pantoprazole.
For the heartburn, okay. And what's the dose? Do you know offhand?
40 milligrams.
1 pill daily. Okay. And do you take any multivitamin, herbs, any other over-the-counter supplements?
I take a multivitamin and I take melatonin for sleep.
Okay. Like how often?
Once a night.
Oh, every night?
Yeah.
What dose do you happen to know?
No.
Okay. Do you have a lot of trouble sleeping?
No.
Okay, so
sometimes.
Sometimes. A little bit of insomnia.
It's just a routine.
Yeah. Difficulty falling asleep, staying asleep?
Difficulty staying asleep.
So you wake up frequently throughout the night?
Yep.
Do you find yourself very tired during the daytime?
I used to, but the melatonin's helped.
Good. Good. How about any stressors in your life? Any major stressors?
I am going through to get my MSN, so yes.
So school.
It takes up a lot of time.
Yeah, I bet. So balancing work and school.
Yes.
I know the feeling. Do you have any financial stressors?
Not currently, no.
Not currently, so you're okay there. Do you ever feel like your stress is unable to be managed? Can't handle it at all?
No, I think I cope well.
Good, so good coping. What about your overall health? Like, what is your health perception?
I think I'm overall healthy.
Okay, good. And you do see a doctor regularly?
Yes.
Okay. And how about the dentist?
Yes.
When was your last dentist appointment?
November.
Okay. And eye doctor? I see you have glasses.
Yes. I went in July.
Okay. And how about OBGYN?
Every year. January.
And last pap smear? Probably was this year?
Yep.
How about menstrual cycle? When was your last one?
I'm on oral contraceptives. I don't remember when my last period was, but it's regular and mine's coming this week.
Oh, wonderful. So oral contraceptives, how long have you been on those?
I've been on them for 7 years.
Okay. Have you ever thought of any other modes of contraception?
No.
Okay, maybe that's something you can always discuss with your OBGYN. Any plans of getting pregnant in the near future?
No.
Are you currently sexually active?
No.
No. Have you ever had multiple sexual partners at once?
No.
Have you ever had an STD or STI?
No.
Okay. Do you use any other contraception while having sexual intercourse? Do you use condoms or any STI protection?
No.
You don't? Okay. Well, that's something we can talk about, especially as a single woman with not a definitive sexual partner. You definitely always want to use a double contraception method.
Okay.
Yeah. Okay, so we talked about your medication list. And do you use any tobacco products?
No.
No smoke, never been a smoker?
Never smoked.
Very good. How about alcohol use?
Occasionally.
Socially?
Yeah.
Have you ever had more than 5, or do you have more than 5 drinks at a time often?
No.
Has anyone ever told you that you think you should stop drinking or cut back a little?
No.
How about other substances, like caffeine?
Yeah, I have caffeine probably once to twice a day.
So 1 or 2 cups a day?
Yep.
Okay, so you don't necessarily rely on caffeine?
No.
Okay. And then how about marijuana use?
No.
Never?
Nope.
And any other drug use, illicit drugs?
No.
Cocaine, heroin?
No.
Okay. Very good. So we talked about your history of GERD, so let's, how about your family history? So grandparents, parents, siblings, any, are they living? Are your grandparents living?
My grandparents are deceased.
Okay, and do you know how they passed away?
One had lung cancer.
Mm-hmm.
One had prostate cancer.
Mm-hmm.
One had CKD.
Mm-hmm.
And the other one had cardiomyopathy.
Okay. Do your parents have is there any other oncology history in your family? Any other cancers? Skin cancer, colorectal cancer?
Basal cell carcinoma.
Okay, who is that?
My aunt. It's my mom's sisters.
Okay. How about cardiovascular history? Anything in your...
So, my mom has hypertension
Okay.
and my father has CAD.
Okay. Any history of a heart attack?
Nope.
Okay.
Bypass.
Okay, so he had a coronary artery bypass. So, and he's still following up with his cardiac issues. And then how about siblings? Any medical issues there?
Nope.
Any diabetes in your family?
No.
Okay. So you mentioned surgical history. What did you mention you had?
I had my tonsils removed.
Okay. Any other surgeries?
Wisdom teeth.
Okay. And did you have any reaction to anesthesia?
No.
Speaking of which, do you have any allergies?
No known allergies.
No known. That's for medications. Any food or environmental allergies? Excellent. Do you have any history of mental illness in your family?
No.
Okay. Have you ever felt overwhelmed? You mentioned no already. But that you ever may need to seek therapy for any reason?
Not currently.
Okay. Very good. Do you live alone?
Yes.
Do you feel safe at home? Any domestic concerns?
No.
Do you feel like anyone is hurting you?
No.
Okay. Do you have any difficulty, I'm sure that you don't as a nurse, any difficulty with your activities of daily living, walking, washing, etc.?
Nope.
Do you drive?
Yes.
Do you wear a seatbelt?
Yes.
Every time? Very good. And other safety measures, do you use sunscreen?
Yes.
Very good. So we did talk about family history of skin cancer.
Yes.
The other thing I was going to mention, vaccines. Are all your vaccines up to date?
Yes.
Okay. So I'll just check those records. And then, did you have any childhood illnesses going back?
No.
Ever get the chicken pox?
I did.
Oh, okay.
Yes.
Okay. So you, after the age of 60, they recommend that you get the zoster vaccine. So that's obviously way down the line. And do you exercise?
Yes.
How often?
3 times a week.
Oh, marvelous. So we just, check to see how healthy people are, if they have, good habits. And then do you have any dietary concerns? Do you want any special diet, vegetarian? Okay. And are there any other special concerns you have for our assessment today?
No.
No? I think that might be all I have. So we can get started with our physical. Okay.
Thank you.
Thank you.